Hello, today we are talking about the medications that may cause a false positive pregnancy test result. Drugs that can cause a false positive pregnancy test result. You have done the pregnancy test, but the results have come out and they are false positive. What medications, what drugs cause this? GERALDMASSA, the health educator, is the name of the channel. Stay with me after this message. We are going to talk about medications that cause a false positive pregnancy test result after this message. Hello, welcome to our channel. I'm GERALDMASSA, the health educator. On this channel, we talk about pregnancy related questions. We answer all your pregnancy related questions. We also do talk about conditions including fertility, infertility, endometriosis, endometritis, and also we do discuss issues regarding polycystic ovarian syndrome. Let me know if you have any questions, and welcome for today's lesson. You are most welcome, and stay with me today as we talk about today's topic. Welcome. Thank you for staying with me. Thank you for staying around. We are going to go straight away to the drugs that may cause a false positive pregnancy test result. And the first drug we are going to talk about belongs to actually a group of drugs. They are called antihistamines. Antihistamines are specifically drugs that are used in treating allergic conditions. For example, if at all someone is like having asthma or any of the allergic conditions, for example, skin allergies, sneezing, drugs used in various allergic conditions. Specifically, these drugs tend to lower the urine HCG levels in your body. So remember, we talked about HCG in one of our videos. You can go look it up in our videos. We've talked about the HCG and how it comes about. So antihistamines, if a person is taking antihistamines, normally these drugs go and lower your urine HCG test results. We are going to go to our next type of drug, and basically this belongs to what we call anti-anxiety medications. The first drug was a drug belonging, the first group of drug was antihistamines. The next group of drugs are called anti-anxiety medications. Anti-anxiety medications or anti-anxiety drugs. So anti-anxiety drugs are specifically drugs that are used in treating anxiety. And remember, anxiety is a state when there's prolonged levels of stress bringing about prolonged worry. Basically, the drugs that are used in managing people who are always anxious, these drugs are called anti-anxiety medications. So there are many of them. Specifically, these drugs affect your levels of urine HCG. So if you are doing the pregnancy test and the test results have come out and they are not clear, they are showing you to be negative, the results are negative, or they are giving faint lines, but for you really are sure that you are pregnant, then you should check. If at all you are taking any of these drugs, then you may need to consult your doctor and see how best these drugs can be adjusted, or how best other pregnancy test results can be got by maybe doing what we call a blood pregnancy test. So the first group of drugs that affect or that cause false positive pregnancy test results are called antihistamines. The next, they are called anti-anxiety medications. And remember, we've said that anti-anxiety medications are specifically drugs that are used to manage or to treat anxiety. The next group of drugs are called diuretics. Diuretics are drugs used in various conditions, but specifically these are drugs used in cardiac patients. For example, if a woman is having conditions, for example high blood pressure, and she is taking drugs, for example furosemide, other countries we call it Lasix. If at all someone is taking drugs like furosemide, Lasix, these these drugs have an effect on your urine HCG. So if you are having high blood pressure and you are already on medication, and among the drugs you are taking, there are these drugs called diuretics, you can always consult your doctor. Your doctor will be able to point them out because there are very many on the market. So your doctor will advise you accordingly. Always consult your doctor before you do any adjustments to your medications. Do not do any changes to your drugs by yourself. Please always consult your doctor so that changes can be made or adjustments can be made by your doctor. So diuretics are drugs specifically that they are drugs that stimulate your renal system specifically, so that you do urinate a lot, and thereby when you urinate a lot, the mechanisms which go on in your system, we shall not go into all those details. There is what we call the renin-angiotensin system, but that is more of like detailed. But specifically, the take-home point is this: if you are taking diuretics are drugs used in managing conditions like high blood pressure, heart conditions, and even if at all someone has issues with their blood system. So if you are taking diuretics, then consult your doctor so that changes can be made. Next group of drugs are these drugs we call anti-Parkinsonism drugs. Specifically, anti-Parkinsonism drugs are drugs used in managing Parkinson's disease, and we know that these drugs specifically have various effects on the body. But when we are talking about pregnancy, these drugs tend to lower the urine HCG levels. So if you are taking drugs for Parkinson's disease normally, and you go ahead and do the pregnancy test, but the test results come out when they are really not clear, then you may also need to talk to your doctor. The other drugs, specifically, there is a drug called heparin. Heparin is a drug used in people who have issues with clotting. It's basically an anti-clotting drug. It's a drug. It's actually available in form of injections. In many countries, it's called it's called Clexane. So if at all you are on medications, you are on heparin, and this is being given for maybe you have issues with clotting, issues like DVT. You are pregnant and you have DVT, or you are suspecting, or you would like to go through the pregnancy process, but you are on medications for DVT, specifically heparin, then it has effects on your urine HCG levels. And also, just as we said in the previous discussions we've talked about, the previous drugs we've just mentioned, you should also consult your doctor. Do not stop taking your heparin all of a sudden. It may lead to other complications which may be dangerous for you. So make sure that you consult your doctor so that appropriate advice can be given on what to do, on which other tests can be done apart from the urine pregnancy test. Remember, these drugs lower the urine HCG levels. They have effects on your HCG hormone, so they may lead to false positive pregnancy test results. So heparin is our drug we've just talked about. We are going to move to our next group of drugs, and these are called hypnotics. There are lots of drugs that put people into hypnosis, so this is also a bit complex, but these are drugs that calm down people, and they are used specifically most commonly in psychiatric hospitals. But also, if you are a patient and you are already on hypnotics, for example Ambien, make sure that you consult your doctor so that appropriate advice can be given, appropriate management can be done. Next group of drugs that cause false positive pregnancy test results are these drugs we call nausea medicines. Anti-nausea medications are drugs that work against, they work to bring down nausea. Nausea is that feeling you get as if you want to vomit, that feeling of like you want to throw up. The drugs that are used in managing nausea, for example, there's a drug called chlorpromazine. This is a drug specifically, it's also used as an antipsychotic, but it can also bring down nausea. If you are taking chlorpromazine, an anti-nausea antipsychotic drug, then you may need to talk to your doctor so that appropriate management and care can be given on how best to go about with this. They can always look for they can put you on other anti-nausea medications. For example, doxylamine. These are really okay. They may not affect your HCG. They may not affect your HCG levels. But remember, this decision is to be taken by your doctor. Do not self-medicate. And remember, this video is for education purposes only. Next group of drugs that cause false positive pregnancy results include Methadone. Methadone is a very, very addictive drug, but if at all you are already taking Methadone for maybe medical reasons, make sure that you consult your doctor so that appropriate advice and management can be done. So, and lastly, we shall go to a group of drugs called barbiturates. Barbiturates include drugs like phenobarbital, phenytoin. These are drugs used in people with conditions like epilepsy. These drugs have effects on your HCG levels and they may cause false positive pregnancy test results. In today's lesson, we've talked about the drugs that may cause false positive pregnancy test results, and we have said that these drugs are very many, but we've picked out what is really so common, and these drugs include antihistamines, anti-anxiety medications, diuretics, Parkinson's disease medications, or drugs used to manage or to treat Parkinson's disease, Methadone, heparin, Hypnotics, anti-nausea medications, for example, chlorpromazine, chlorpromazine, and also anticonvulsant drugs, and then lastly, barbiturates. So, if you have any questions in regards to what we've just talked about, ask me all your questions in the comments down below. I will answer them personally. Remember to like and share this video with our friends so that they get to know about these drugs that cause false positive pregnancy test results. Whenever you do the pregnancy test and it gives you results that are not really so clear, always know that there are many other tests that can be done. There is the blood HCG test, which can be done by getting a sample of your blood in the lab, and then they look for the levels of HCG hormone in your body. Then also you can always wait for at least 4 weeks or 3 weeks and then have an ultrasound scan done, and then of course whatever comes out you can always discuss with your doctor on the best advice to go about. Thank you for passing by. Thank you for attending today's lesson. I'm really so happy to have talked to you about medications that may cause false positive pregnancy test results. Whenever you do this test and the results come out when they are kind of like not clear, always know that there are medications, there are drugs that can cause these results to appear the way they appear. Have yourself a fantastic and healthy day. May God bless us all. Bye bye.